So good afternoon, everyone. We're extremely excited to see you all today, and thank you so much for taking the time out to participate in this webinar. Though the term webinar is a little bit of a misnomer here because we're envisaging this to be a conversation which is informal and free-flowing and argumentative, and hopefully it'll leave us with a lot of food for thought at the end of a couple of hours. Before we begin, I'd like to take a couple of minutes and walk you through why we decided to choose this particular topic for today's discussion. So at Sambodhi, we are MLE partners for a number of advocacy interventions, and these interventions deploy a multiplicity of tactics. It could be media advocacy, could be capacity building, could be coalition building, engagement with key influencers in the government, and so on and so forth, to seed and catalyze transformative change. And one of the pervasive strategies that is used is evidence generation and dissemination. And we all know that it's a very, very critical piece of the policy making and policy implementation puzzle. Having said this, a lot of questions come to mind, specifically when, how, and where is evidence actually used by policymakers to construct or to frame or to inform specific decisions in the policymaking arena. And we at Sambodhi were sort of grappling with several of these questions. So what are some of the characteristics of evidence which enhance its uptake? What is the flavor of the policymaking arena which facilitates uptake? What are the barriers in the policymaking arena? And what this means as evaluators is that often, because we don't understand the nuances and the complexity of policy making as well as policy implementation process, we are not able to capture the true essence of spirit of an advocacy intervention, and which leaves us lacking sometimes in terms of innovation when we're thinking about tools and methodologies and strategies. Through today's conversation, we want to be able to unpack this black box of evidence use. And essentially, we want to be able to share some insights on how implementing organizations could probably use evidence more effectively by getting a better sense of the nuances of policymaking, and how we as evaluators and also as donors can be more sensitive, and we can craft appropriate approaches to determine, in quotes, progress or success of these interventions. And we could not think of a more fantastic cohort of speakers to help us unpack this black box. So from an implementer perspective, we're delighted to have Ranu Bhogal with us, who's Director, Policy Research and Campaigns at OXFAM. And Ranu has over 30 years of experience on a spectrum of domains in the development sector, works deeply on policy dialogue, analysis, and in the advocacy space. She holds a master's in economics from the Delhi School of Economics, and then went on to IRMA. From a policymaker's perspective, we have Dr. Kajal, who is Executive Director of Rural Electrification Corporation. And Dr. Kajal is a clinically trained doctor, a gynecologist, and armed with this sort of knowledge and experience, she's provided technical, administrative, managerial oversight on a host of RM and CHA issues across, again, a large number of low and middle income countries. And apart from being a doctor, she's also a Master of Science in International Public Health from the University of California, San Francisco. And donning the hat of an evaluator, very pleased to have Niranjan with us, Dr. Niranjan, who's the Director of Population Council, and where he provides strategic and technical leadership to answer this question, which is plaguing a lot of evaluators, which is what works in what context, for whom and why. He has over 20 years of experience in public health and policy-oriented research. Again, multiplicity of issues ranging from sexual reproductive health rights, migration, gender-based violence. And he has a background in statistics, as well as population studies, and then went on to do a PhD in population studies from the International Institute for Population Sciences. Over to you, Ranu.
Thanks, Kadambari. Thanks for the introduction. So thanks for inviting me. I'm looking forward to this deliberation and argumentative conversations. I'll run through a quick set of few slides and then go into some details into what OXFAM has been trying to do in terms of, I would say, less of policy making and more of addressing gaps and getting policies implemented, because I've always maintained that there is no dearth of good policies in our country. The big challenge is to get them going. But I have tried to select kind of distinct examples to give a flavor of different levels at which the policy influencing work is done by OXFAM. But before that, some quick kind of a thing of what helps us in framing our work. So I think I'll have to remove this. Yeah. So basically, before we start or anybody starts a process of engaging with policymakers or implementers, we have to be very sure about the issue. So the knowledge and technical rigor is absolutely critical, and then need clarity about why a particular piece of evidence is being collected and how it will help us to address what we want to address. And who is our target audience, whether it's if it's a report, then who's the reader, if it's a brief. Again, audience is very, very critical, and it has to be of interest to them. And what is the methodology or mode of presentation to do this? And the why also has to be very, very clear. Why are we doing this bit of evidence gathering? For what purpose? And is it for designing new policies, to changing existing policy, to addressing implementation gap in existing policy, or to influence a popular narrative? So that clarity is very critical. And also the angle we are adopting in this, specific suggestions, like implementation gaps is usually we offer specific suggestions, offer a damning critique, like I'll be talking about our inequality work. So it's really critiquing and then pushing for some kind of action, or giving a new angle to an old problem, or pushing for a clear agenda. And of course, we need to be clear that whatever we are presenting has to be different. There has to be a value addition instead of another of those reports. And of course, this is very, very clear to everybody, I'm sure. The target audience has to be clear to us, and what they need on this issue, what format they can absorb. Not everybody has the time to absorb a 100-page report. So maybe it's a 4-page brief, or even a PPT, or just a 1-pager. So all that becomes very important about when you keep the audience in mind. The tone of is also important, cannot be a critical tone only. It has to be, even if you're critiquing, are you being solution focused is also very important to engage, especially engaging with the policymakers, and the format in which the evidence is produced. The what will be look at the structure, how we are going to present the evidence, at what level is the analysis is being done, national, district, ward level, depending on the issue we are trying to address. Also, the comparisons that we make, is it, you can read the PPT, the slide, but who are we comparing ourselves with? It's like when we do our inequality work, we often compare ourselves with the neighboring countries, with the BRICS nations. When we are talking of, say, effect of pandemic or health inequality, we look at state-based data and try to compare. So that's how we structure the evidence. And, the presentation format I've already talked about, and infographics and any additional material. We can also, think in terms of creating short video clips that we use in social media. And that's what brings me to the third point about dissemination and amplification. So there has to be a clear dissemination plan and a media and social media advocacy plan. The strategies we normally use to maximize influence is to build rapport, obviously, with the target audiences for the message, and identifying champions within the system. So it is, if it is the State Commission for Protection of Child Rights, you identify champions there. If it is a legislation process that's going on, I mean, although under FCRA, once a process is on, you can't get involved. But before a process starts, you identify the champions within the system. So if it's new education policy, then identifying the right kind of champions amongst the political parties and the bureaucracy, and, you know, build rapport and explain your kind of points to them. Also amplifying the narrative through media, I've talked about it, and building a supporter base for the message, which we do through building alliances and networks. And the challenges that one faces is obviously that eventually decision-making, we all know, is political. It's a political exigencies that kind of decide what is decided by the government of the day. And it may not always be evidence-based, but we still have to continue to provide evidence and push for those decisions that we would like the government to take. There is always a confirmation bias in messages, and you know, people see and hear what they want to see and hear. The latest example is, for instance, the increasing age of marriage of girls. You know, there's a huge division even within the civil society on the issue, multiple views, but a lot of people would say, no, if you increase the age of marriage, it is all good for the girls. But you start unpacking it, then you can see the other side of the story. But that's a challenge. And the last is, even if you convince the system, so to say, to come to your side, there could be, you know, capacity, lack of funds. And often, I would say, more than lack of funds, it is often lack of human resources to actually deliver what you know, to implement the decisions. So human resources, especially in many states, we find it's a major challenge for implementing even on agreed kind of policies. Finally, how do we define success? Well, if we are able to get a shift in the policy or implementation, that's success. If we are able to get support, popular support for the shift, that's success. And greater awareness on an issue is success. And if media is covering it, is also a measure of success for us. I think it is important that it becomes part of the popular kind of conversation. So we measure success like that. I will quickly share, I think I will manage to do 3, but let us see. There are these 4 examples I have picked up from our work. So one is the work we do on inequality. I'm sure many of you would be familiar with the January Davos Week of Action and the Global Inequality Report that comes out every year. That talks about increasing inequality in the world and in countries. What we decided to do about 4 years ago is to start bringing out an India inequality report, because we thought that till this becomes a conversation topic in the Aam Janta, and people need to start understanding this issue instead of just sticking to those billionaires in the global report. An India-focused inequality report is required, and that's how we started producing an India inequality report. And what we have realized is that as a result of this past 4 years of work in particular, we have been able to mainstream this issue quite a bit, so much so that you know, in this year's inequality report has been quoted by several academicians. It's actually, people have started waiting for it. Even some political parties have referred to this report during the budget session. And the chief economic advisor in the economic survey also talked about this difficult choice between growth and inequality. And, you know, our view, of course, is that it's not a difficult choice. And there's increasing evidence globally now that just increase in GDP will not address the major challenges we are facing as countries. We have also tried to bring in the element of not just wealth inequality, but gender and caste and regional inequalities, which are very critical for a complex country like India. So, and we have used multiple strategies to amplify this whole report. There is media level engagement on television, in social media, and print media. We also have now started going out to vernacular media in Telugu, Gujarati, Odia, and Hindi. And we bring out a short Hindi version also. So all these efforts are to reach out to a wider audience and to generate a narrative at a wider level. The second example I want to talk about is some influencing we managed to do for this project, which is a World Bank funded education project called STARS. Now, this project is essentially a loan where 15% contribution comes from the bank. To cut the long story short, basically what we found an area of concern was that the project was actually trying to push for partnership with non-state actors and non-state actors, including for-profit players in the education sector. And this project is proposed in 6 states, and which would have involved handing over completely the operations and management of government schools to these actors, and outsourcing services and seeking support from management firms and direct benefit transfers in terms of school in the form of school vouchers. We were able to reach out to, firstly, we wrote a letter to the World Bank Vice President of the region, and a letter was signed by well-known academicians, the Teachers Union, and we were able to actually package in a lot of global and national evidence to say this is not going to work. And we are very happy to say that as a result of this, and we used our OXFAM international connections at the World Bank board to also raise a question in their board meeting. And as a result, while the loan was passed, they assured in writing, it came in writing that they will not involve for-profit private sector. I'll quickly share a very important example because it's a more rooted example in the state of Uttar Pradesh, where the Right to Education forum called Corp has done some excellent on-ground work to influence again the policy implementation of RTE. And one of the things that they have been able to do effectively is to push for implementation of a particular section called 12(1)(c), which guarantees that 25% of the seats in private schools are reserved for children from economically weaker sections, particularly Dalit Muslims and poor children with annual incomes of less than 1 lakh. So what Evidence Corp managed to get was that from 2009, when the act came to place, till 2014, not a single such admission had taken place. It was zero enrollment. So this data was there. They also identified a gap in the rules that were formulated by the government, which said that so long as there are seats available in government schools, there is no need to implement section 12(1)(c). And obviously no government would ever say that we can't admit children, and no government order had been issued on 12(1)(c). The score got pushed for the issuing of this order. And then they realized that the draft order said 3 lakhs as a cutoff income. Again, it was pushed and brought it down to 1 lakh. Still, there was no action. And then, they actually had to take a legal route where then they widened the network of people, the stakeholders who would be contributing to the formulation of the PIL. And IIM Ahmedabad has an RTE cell that tracks the implementation of 12(1)(c). There were All India Parents Association. We identified 2 champions in the State Commission for Protection of Child Rights. And, a whole lot of people then got their act together, and the PIL was formed, and the High Court instructed for immediate action for implementation of this provision. So from zero enrollment in 2014, it has been brought up to more than 12,000. I think it's 2018 data or 19 data that I have. Thank you very much.
Thank you for having me. And coming from this, health background, I did my post-graduation in Ops and Gynae, and then later on moved to IAS. And it has given me extreme, perspectives on both sides, I can say that. So I'll just take you, let's go, take a walk through this role of evidence in policy making, being on this side of the system, as you call it. So I would like to, give some of the examples like how this policy is decided and what I have, come across during my experience as an IS officer over past 13, 14 years as of now. So as Madam Ranu has already gone through it, so we all understand what is evidence-based policy making. We know that we have to use what we already know. We have saw a lot of programs that are being run. So we have a lot of learnings that come up from those programs. So we should be able to, learn from those shortcomings, or maybe I can say there are always certain learnings that we always get from these kind of programs, and then to build more knowledge and to use that for our new policies that we want to bring into place. These are the certain principles that I have come across during search in the literature, and we understand that we have to build and compile rigorous evidence regarding especially about cost and the benefits. We should monitor the program delivery, use impact evaluation so that we know that whether we are really getting effective or not. We should use this evidence to improve our programs, scale it up, what is working, and whatever is not working, we should leave it behind and then redirect our funds away from those ineffective programs. And this policy making, which is evidence based, should always encourage innovation and test new approaches. So now what is the problem? So we all understand, we all talk about this evidence-based policy making, you hear it a lot, but is it really, everything? Because what we understand from evidence-based, the framing is very narrow. From a policy maker's perspective, I would say we would have to explore this complexity, the context, the value-laden ways, the various stakeholders are there. They all have their competing interests. So under this ecosystem, how you fit in this evidence-based policy making. And I really would like to quote Dr. Iqbal Dhaliwal, who's from JPAL. I am sure you must be knowing him. He was an IS officer and now he's working with JPAL. So he says that instinct, inertia, ideology, and ignorance, these are the 4 I's that drives the policy making. So let's see whether it's like, how does it work? So, this now when I sit on this seat and, there are many stakeholders who come to us and they present the evidence that, this is something you should work upon. So I see it from 2 perspectives, whether it is a hard evidence, which I see, which is factual, number based, more quantitative, and you can make the sense out of it. And there is some soft evidence which is generated from qualitative interviews, maybe reaching out to the audience, and those are the kind of mix things that I come across usually. And I feel that whatever is presented to the policy maker, the most important thing is the credibility. I mean, first of all, I would say that all the people who are in this advocacy business, like, they should ask this question, that if you're coming to a policy maker, why they should trust you? What is your credibility? If something is coming out of your mouth, why should I first of all listen to you, and then I should act upon it? So if you have that credibility, then I will reach to the next stage of, now if you're presenting to me something, then I will go into the quality, the accuracy, the objectivity with which you have done your studies, or what you call the rigorous designs, have they been followed? I trust that if you're talking about that you have done this study design, you have done this population, so that trust is built. And very important is relevance. Many of the policies, I see that something which is very good with evidence, there's a kind of gap. There are people who are doing research, there are people who are making policy, but you may be doing research on something which is not relevant to me. As a policy maker, when we talk about this whole political thing, in the democracy, political representatives, they are representing the population, right? So we need to understand that they understand the expectations of the people, what people expect. So we need to, frame our policies around that. So is your research relevant to what I want? And then the practicalities, which I'll give you some of the examples by which I'm sure you should be able to appreciate it better. So these are certain things which I would say that, when you are in this advocacy business, just think about all these things. whether you have that experience and the expertise on which you are working, for how long, what you have done, what is the crux, what you're coming, because there's so much of evidence lying around. The policymaker has to understand that if you're coming to them, you have the experience and expertise in that sector. There are judgments which we should try to remove those biases and other stuff. Then habits, traditions, values in which our ecosystem is working, are you aligning with that? You know, the pragmatics, contingencies, there are various lobbyists, pressure groups, the evidence which comes from the research and the resources. Do I have enough resources to actually follow what you're telling me to do? So I have limited resources, I have a limited kitty, so I have to prioritize my stuff. So maybe the research has been done rigorously, we have got very good evidence, the credibility is there, it is very accurate, it is relevant, but I may not have enough resources. So there are so many things that come into play when you actually go for a policy making. So this is a chasm. We all understand government is on one side, researchers on the other side, and we have this distance. Now, how can you improve this dialogue? What, why, when of that? So as I told you, a lot of evidence is there in front of us. It is not just coming from the researchers. Even government has a lot of data itself, which we can go through it. As I said in my first slide, to run through it and understand from that perspective that what were the shortcomings. Should I repeat it or not? How do I go about it? Political will, then making those amendments in the legislations if you need to change the policies. So those are the certain things which becomes like certain bottlenecks, I would say. So this is the yin and yang I think Kadambari was talking about. When you talk about the policymaker and the researcher side, so it's more colloquial on the policymaker side. You are scientific. We want relevance. You are talking about empirical evidence. We want something reasonable time, in something which is in the reasonable time. We want to come out with a policy which is expected from us, but scientific evidence may take very, very long. We need something within the time, like the time frame has to be decided, but theoretically scientific research may not be relevant and in that time frame. And then clarity. Many of these researches, as we all understand, I've also come from that research background, that we take a lot of assumptions when we make those models and then qualifications. So understanding that evidence is also very, very important, that how much it will be actually applicable to the realistic scenarios. So I'll just talk about a few examples from my own experience. So we know that Niti Aayog is there. Government is now working on those lines, that we really want to bring this evidence into play and then make our policies, do the prescriptive analysis, and then be able to make more evidence-based policy making. So given all the context that I was talking about, Niti Aayog has already set up this data monitoring evaluation office. You all are aware of it. Now this digital data governance quality, this framework is coming up, data DGQI quality index, in which they have made it mandatory that every ministry has to go through these kind of things, where data generation has to be granular. You should use technologies, and they will assess you. All the ministries on those parameters, they will rank you on those parameters and tell you whether you are really aligning with evidence-based policy making or not. National Institute for Transforming India, again under Niti Aayog, is working. Even from the current organization where I'm working right now, Ministry of Power, we are also trying to set up all those kind of data strategy units where we can have this sort of data, clean it up, and use it for our policy making. Some examples from my previous tenure, like Better Birth Trial, I would say very scientifically, rigorously done. You all must be aware about Dr. Atul Gawande. He is the principal investigator. The checklist, he's author of that book, the Checklist Manifesto. So this whole checklist was, we ran this pilot in Uttar Pradesh. It was rigorously done. The results were amazing, but this could not get scaled up in UP. So, maybe sometimes the science is there, the evidence is there. The issue is we did not have the enough resource and other stuff to actually get the checklist and everything in place, and that kind of time available so that everything can be done so much in nitty-gritty. Kangaroo mother care, again, this was the initiative with the World Health Organization running very effectively. It could be scaled up. It was rigorously done. Less resources were required. People were trained immediately, and this whole has become sustainable. Tamil Nadu is one of the first states with the help of JPAL. They have set up an annual innovation fund since 2014 for this particular sort of a thing. And very recent example of COVID-19 management, I would say that is one of the examples where you can see when the science is not there, not enough evidence is there, how this pandemic management has happened. It is all about, the evidence is coming from so many resources and there was not enough rigor was there. So you know how the policy has been changing, with as we learned more about COVID-19. So what is the solution? And just my last slide, I was just say that it is definitely somewhere we have to match the pace. The policy making and the scientific community have to match their pace. We really have to refine the nuances of our research findings so it is easy for the policymaker to understand what you're trying to say in a very, very short span of time, since most of us are very, the time is very limited with us. So I would suggest and recommend all of you like an elevator speech, if you can really concise it and put it in a very easy way. More proactive role definitely from our side. We should also seek evidence and ask for where it has happened, what are the best practices, how I can go about it. We should be trained, I agree, that in monitoring and evaluation of the program, so that we understand in a short span of time that what evidence you are presenting to us, is it really relevant, is it really worthwhile to look into, and then act upon it. And always look for the ethical solutions and do not forget the most vulnerable. So my winding up line is that follow the evidence wherever it leads and please question everything. That's how I work. Thank you so much. Thanks a lot for your time.
Thanks a lot, Kajal. And that was fantastic. And I think lots of questions, at least running in my brain. But first, I'm going to ask Ranu and Niranjan to quickly respond, provide their perspectives, and then I have a bunch of questions. So Ranu and Niranjan, any comments, any questions?
Thanks so much. It was really wonderful to hear both Dr. Kajal and Ranu. In fact, the presentation from Dr. Kajal has the both sides of the story in terms of how the evidence and what the evidence the evaluators or researchers do versus the policymakers respond, or what are they actually looking for. I think that's the biggest gap that we have today. And there are no easy solutions, as Dr. Kajal also has rightly pointed out, but how much, what solution can really work in this setting, and how one can take that evidence to the advocacy or into the policy, and what is that process, which is going to be much more, which has been complex so far, and then how to ensure the support and the cooperation between those constituents in order to have that evidence-based policy. We all have, for several decades, we've been talking about the evidence-informed policy. But I think we are gradually getting there with all these initiatives from NITI Aayog and many of the advocacy implementing organizations which they have been doing, taking the evidence to the policymakers. But my larger question is how practical, or where do we have those critical case examples that have actually informed the policy, which can be attributed to the evidence that is being generated? It's very little at the moment. Thank you.
So I think, Niranjan, if I'm hearing you right, you're saying that you're kind of going back to, one of my favorite quotes, which was by, Carol Wise, who said that the consensus most studies seem to bounce off the policy process. So the question that you're asking is what are those cases where evidence is actually used to craft a policy or to bring about implementation improvements? Am I understanding your question correctly?
I'm just saying that those such cases are very limited, and there is a complete imbalance between what the research that's out there versus what the policies and how frequently those policies are being modified.
I think it's a great question. So to both Ranu, you as well as to Kajal, I think both of you beautifully elucidated what what I would broadly bucket as the characteristics of evidence, right? Which facilitate uptake. What's the type of evidence, the designing, the framing, the presentation? Kajal's your point of hard versus soft. But I mean, if both of you through your own work can provide us some examples, and Ranu, probably I'll start with you in the policy implementation improvement space, where you found evidence. And of course, there, as you very rightly mentioned, there are a whole bunch of coterminous strategies which go along with evidence. Maybe in your experience, where evidence has helped the implementation machinery, and then Dr. Kajal, to you on where evidence has been used to, say, craft a roadmap or put together a policy brief.
Thank you. Yeah, I was very happy to see a lot of overlap between what I presented and what Dr. Kajal was sharing, from both ends. So good to see that. So in terms of your question, Kadambari, that example of evidence. So going back to the example I was talking about, the Section 12(1)(c) implementation, it all started with getting the evidence that there was zero enrollment.
Right.
Then it also then involved identifying why was it happening. So again, going through the rules that had been framed by the government, then identifying the gap in the rules itself, and then again trying to reach out to the people in the system to say, okay, these need to be revisited. And then getting some champions on board, and then working with them. And getting the buy-in of the system. So that's how the evidence was used for this 12(1)(c) piece. And then obviously, because there is always a pushback from people who are bound to lose out, or this thing of getting children from economically weaker sections in the so-called public schools, which are like elitist schools, there's a lot of pushback from the management of the schools, from the parents of the school system. They don't want their children to mix with the children from economically weaker section. So there is a whole thing of societal kind of pressure through the management committees of these schools, and working around that, and then a lot of work that needed to be done with the parents of these children. To make them aware of their rights, to work through the grievance addressal system, working with the basic Shiksha Adhikari and getting the evidence that, despite being eligible, their children were not getting admission. So that's evidence. And then it's the job of the basic Shiksha Adhikari to take action against those school management. So all of it is really constantly collecting evidence from ground and providing it to the right person in the system to take action. I hope I've answered your question.
You absolutely have, but you've also raised two other questions in my mind,
Okay.
which is what you always do, Ranu, and we love you for that.
Okay.
Dr. Kajal, quickly, your response on where have you seen where evidence has been provided, and this has actually led to the crafting of a roadmap or a crafting of a particular policy?
See, I would say, it's not that we are doing everything which is like not scientific. I wouldn't say that. Being in this system now, I have seen enough to say that definitely, we base our things on certain, even if you don't call it scientific, but you try to see, even if some policymaker is not very, they understand the nitty-gritties of evaluation tools, but still everybody understands the basics of best practices, like, being done by various, like similar countries, low middle income countries, or maybe across the states. That is there. That is the bare minimum that I've seen. Every ministry, every state government, you go for anything new, they will ask these questions. Okay, did you check whether there are certain best practices across in our country somewhere? If not in our country, okay, go find somewhere else, neighboring nations or somewhere which are at par with us, the low middle income countries. Are we doing on similar lines, or there is some other? And there are a lot of exposure visits that used to happen. Maybe it's reduced a little bit, but still, with the help of many international organizations, I've seen there's a lot of exposure that has come to us. So there is definitely a certain base on which things are based. But then again, I understand there is an ecosystem in which we all are working. So there are many stakeholders, as I said, and they all have their competing interests. So you have to deliver amongst that ecosystem with the best. See, I would say the success, when you say the success comes from a few things. That your success should not be just measured by saying that, this has been replicated, maybe, like across the country or maybe across the state. Sometimes the success can be measured in a limited way. For example, you want to make a policy, but you are unable to satisfy everybody, and it always happens. One or the other stakeholder will always have a problem, so you can't please everybody. But if you can deliver 80% of what you are trying to do, I would say certainly that's a benchmark that you have done enough in that direction. So your speed may get less, but if you're going in the right direction, you are effective, you are inclusive, you are taking care of the poor and the vulnerable, you are able to sustain it. And I feel that it is relevant to the expectations from what society needs from you. I mean, these are the parameters on which you should measure your success. And Kadambari asked me, like, what is the ways, like, किसका आप मानते हैं किसका नहीं मानते हैं, like which organization you would say, like, private sector providing the research or some other person providing research, like it doesn't matter. As I told you, we are there to listen and understand what you're coming to us. You need to understand one thing from my perspective is that you have to tell us in a way that resonates with the this whole parameters that I'm just talking to you about. Is it relevant? Is it effective? Is it inclusive? Is it sustainable? Is it, all those, is it converging? So if you are able to satisfy me on most of the fronts as a policymaker, not just me, I'm just saying on behalf of the policymaker, I guess somewhere, I feel everybody is open to listen and to try it out. One of my seniors used to say, which I always remember saying, that, UP is a graveyard of pilots. So many pilots are being done. Sometimes the government doesn't even know. It happens. And many people are doing wonderful works without the knowledge, because it doesn't need government permission or anything. So it's not that we don't want to learn and we don't want to understand, but see, the success is to be able to bring a win-win-win solution for almost every stakeholder. That's how I see it, after so many years of experience, that if I'm able to deliver that much, I may not be perfect, but again, if I'm able to deliver the best, that's something I see as a, like, for example, Mr. Niranjan said that, we are not using evidence quite a lot in that sense, but I've seen many policies now coming up, and all the ministries taking the directions in those lines, setting up those, strategy units, setting up our own analysis units, and involving people to understand. Every ministry has cooperation. Every ministry is working in close, I would say, very closely with, whether it's health must be working with OXFAM and Gates Foundation, or so many NGOs are working and they're doing wonderful work. Similarly, our ministry is also right now, Ministry of Power is working with USAID is there, other people are there. I mean, I'm just, whatever is coming on top of my mind, I'm taking the name. So there are many good stakeholders, players, and we all want to achieve the same thing. Only way is, like, you just have to align your ways together. And that is the thing that I was talking about, the chasm that we have to build. We really need to match that pace. We need to see what the policymakers want right now. What is their immediate expectations? People are expecting from the politician. Politician is working with the bureaucracy. So it's something that we all have to understand, that we really need to match that pace. And we need to bring those kind of evidence in front of us, which is helpful in making decisions. Something, for example, recently Ministry of Health was working on the rare diseases, that they took the meeting and they called all the big ministries, told us that, you really need to start now working towards these rare diseases. Things are changing. Earlier we were talking about RMNCHA, reproductive maternal child health. Now we are talking about this epidemiological shift has happened. We are talking about hypertension, diabetes. COVID has really given a new perspective to all of us. Every, I am sure you all appreciate how government has also changed their working style and working cultures and everything. So things are happening, they are going in the direction. But again, as I told you, all those situations in which we all are working, if we align, if we can save the time, bring the gist in a very, very short span of time, which the person can understand and it resonates with their vision and what they want to achieve, definitely that will take off. That's how I would like to recommend to all the people who are in advocacy.
This is great. And as I said, I do have some questions, but I'm going to, turn the floor over to Niranjan. Niranjan, I think, we were talking about this and, in your presentation, I know your presentation kind of addresses this. And I think as evaluators, we are plagued with this concept of what is progress or what is success in advocacy interventions. And I think both Kajal and Ranu alluded to this. So over to you, Niranjan, and then we can, we can continue the conversation.
Thank you, Kadambari. I think both Dr. Kajal and Ranu has alluded to in terms of what does success mean in uptaking the evidence. And I have some thoughts, mainly from the evaluator's perspective, because I've been into this space for several years, working with the health department and health ministry on many occasions, looking at conducting research and also doing the evaluations. And from my perspective, the success for evidence uptake in policy programming is when there is that sufficient increased awareness of the issue among the policymakers or even the program managers. Not necessarily that every evidence needs to change the policy or modify the policy, as Dr. Kajal or Ranu has pointed out. But what it also means the changes in beliefs or attitudes and the communication between the different stakeholders, between the researchers, the policymakers, the program implementers, and the funding organizations, or any other stakeholder who is well connected in understanding the issue. So is that those are the kind of steps that could be even classified as a success, and change in the practices or response action. And the most important outcome, and often that is seen as the something that funding organizations or the people in the advocacy implementing organization would like to see, is what has been changed as a written policy, or whether or not the bad policies and laws are prevented, and how is this program is modified significantly to make sure that it connects with the evidence. There are a couple of examples, quick examples that I would like to share. In case of the HIV/AIDS, as many of you may know, that in the early times of that HIV/AIDS epidemic, there was a whole lot of reporting that was happening in media. Mostly it was negative reporting, increasing the stigma and discrimination about the people who are involved in sex work, or about the people who are diagnosed HIV positive. So there was this whole effort of the media advocacy that has started, and started sensitizing the journalists, sensitizing the editors, and working with the other constituents at the local level who are actually reporting the news. And what was seen eventually is a significant change in that reporting, from the negative reporting on the HIV per se, to the more about the positive reporting, and being sensitive about the people who are diagnosed positive. And that, and I was involved in evaluating that advocacy, media advocacy initiative. And what we have seen was, there was this tracking of the newspaper articles, which actually happened since before the start of this media advocacy to whole period, and there was a clear pattern, so that it doesn't actually lead to any tangible outcome per se, but what it is actually leading to is that significant change in the practice and the pattern of reporting. That was a one typical example. And the other example is among the migrants, in case of the HIV/AIDS, where there's HIV prevention interventions only in the destination areas, and the research that was done has actually said that, if we want to really prevent HIV among the migrant households, we need to work in both destination and source areas. And that's how the corridor of intervention that came into existence at the National AIDS Control Organization. And the one thing that has worked in terms of the evidence uptake is that in that research, the researchers actually work with the policymakers directly, because policymakers has this the vision, as Dr. Kajal said, had the larger question that, how do I control the HIV in the source areas, the source states, for example, Bihar and Uttar Pradesh? What is what is the evidence that is suggesting? And there was no evidence to actually suggest some program implementation. So in summary, what I'm saying is, the key element is the relationship, the collaborative work between the researchers and the policymakers actually helps in helps in evidence uptake at that level. But whether is the success possible and measurable for all advocacy initiatives? Not always, actually. Because it all depends on the type of issue, the type of intervention, the complexity, the political and cultural context. And as Dr. Kajal mentioned, there are several other parameters to it, including the budget availability or the resources availability, or many other factors that are involved. The typical example is the family planning. And we have the family planning programs for several decades. And we are making a significant progress in terms of the family planning program. But what needs to be done is one of the examples that all have been working together with Mamta, C3, and several other organizations, is to demonstrate that the family planning initiation in the early years of marriage actually helps the couples to decide when to have children, how many to have children, and how much to space children. There is that, what we see in that pattern is there is that realization on the issue, but how to operationalize it, what action that needs to be taken, what outcomes can we achieve, is some significant work that's needed. And that's where is the complexity that exists. And there's a similar example for adolescent health, where I'm personally involved in doing that. And one of the learnings that we had on the principles in evaluation of advocacy interventions per se is the alignment among stakeholders. The stakeholders, when I say the evaluators, the funders, the policymakers, the program managers, on the type of outcomes. Whether the outcome we want to see is going to be the large transformational change, or is it a slow and incremental change? And that's how one has to define what outcome can be achieved from that process. And many times the advocacy evaluations do not capture the processes, because the process is going to be key critical thing. There is this, while we all think that the evidence is generated and presented and has been referred in the program or policy, but what is clear is that the socialization that goes behind behind that evidence presentation is also a key important factor in the uptake. And the defining the small wins, whether the change in attitudes, beliefs, or awareness, and outlining the interim outcomes. For example, Ranu pointed out about the champions partnerships, And those are going to be really critical. Do we have enough number of champions, and what are they talking about on the issue? And outcomes, many times for the advocacy initiatives, the aspirational outcomes are aspirational. No harm in having the aspirational goals for the initiatives, but are they realistic? And how much can one advocacy initiative achieve? And then there is a big question about the contribution versus attribution. Everyone wants to see that how advocacy, research advocacy or the program advocacy actually going to cause an impact and change in the policy. But for all these social and health and developmental interventions, there are several stakeholders involved, and there the contribution comes as a key factor rather than the attribution, because it's not a medical intervention where you conduct research on one pill and take that pill to administer to different populations. The government can actually make decisions. So that's not the cause and effect in terms of that relationship. So this slide is just a kind of a repetition of what I said. And finally, I wanted to end by saying that the advocacy interventions are much more complex and fluid. And measuring the cause and effect is not only difficult in the complex settings, but it is important to take into consideration several dimensions, and there are several innovative methodologies to conduct the evaluation of the advocacy initiatives. Thank you.
Thanks, Niranjan. And it just, if you can just leave that last slide on for a couple of more minutes. And I just have one follow-up question. And then, of course, I open the floor to Ranu and Kajal. So in a lot of the work that we're doing, Niranjan, there might be advocacy interventions wherein you've got a spectrum of strategies, a basket of strategies, and these are being deployed in a UP, a Bihar, an Odisha, a Rajasthan, a Maharashtra, and say Karnataka. And a lot of times we are asked, this particular question, which is, coming in from TORs or RFPs or whatever you call it, saying that what strategies are working in what context, for whom, and why. Now, given the complexity of advocacy and given the intricacies of policy making, and given a cocktail of actors and ingredients that go into this, do you think that's even a realistic question in advocacy? Because I might use different permutation combinations of, say, media advocacy, capacity building, social movements, community mobilization, and evidence. And I might see great success in a Tamil Nadu, but I might see, because of media advocacy, but I might see little success of media advocacy in, say, Odisha. So is that realist? I mean, in evaluation, the jargon is realist synthesis. Is that even a question we can ask in advocacy?
I think that's a kind of a million-dollar question, because the thing is that everyone wants to know what works or what has worked in a particular setting versus what has not. And in case of, and you rightly said, it's so much complexity that exists and so much fluidity that exists. And there is, and one of the points that Dr. Kajal has mentioned, which resonates to some of the work that I've been doing, is more around what is that vision of the policy maker or a decision maker in that case, versus what is that research or the evidence or what advocacy that has been done, on what issue the advocacy has been done and which evidence is being taken, and does that match with the vision of the decision maker. So from that context, it may be that in certain settings, the hard evidence actually plays an important role, and in other settings, whether it is the hard evidence or the soft evidence doesn't actually make much of difference. The reason is that the reason could be, there could be many reasons, and that's where I think one has to be, when in the TORs, if it says that what has worked in what context and where, that's a very difficult question from an evaluator's perspective to answer. And one of the recommendations and the learnings that at least we have had at our organizational level is to make this evaluation also be a bit flexible, so that even when the evaluators or researchers come into this evaluating the advocacy interventions, the implementing organizations as well as the policy makers or the stakeholders do understand that the question or the outcomes that they have may not be the right outcomes to define as a measure of success, and there could be a lot of changes that can happen, and that's where it has to be flexible, and that's a very tough question to answer, Kadambari.
We ask that because we're grappling with that quite a bit as evaluators, because we see that, as you rightly said, it's so complex and fluid, and the same evidence generation, dissemination, or the same media advocacy plays out so differently, that even comparing across contexts or even comparing across districts in the own state becomes very, very different. Because the BDO in one state is different from the other. Communities in one state, one district are very different from the other. I want to bring quickly sort of Ranu into this. Ranu, given your long experience in just in this advocacy space, how do you, when you're sort of putting together a proposal, and this is sort of a sort of more of a practical question, when you're putting together a proposal for a grant, what are some of the things that you would put down as success during, say, the grant period? Like, how do you look at success?
So,
and what are some, sorry, and also what are some of the challenges that you face, and being totally candid, in your own framing of success?
I think it depends on what intervention you are talking about. So
Right.
if it is something what Niranjan was say talking, if it is about, say, changing social norms, we do have an intervention on changing social norms on violence against, that inform violence against women and girls. Now, how do you measure a change in a norm that perpetuates violence? It's very, very difficult. So what we have done in that proposal is that even a small delta change, like small shifts, like awareness created. How many people are even talking about this issue, that there's a linkage between social norms and violence? And then what kind of social norms result in what kind of violence? Having conversations with men and boys and not just women and girls. So, mapping and doing some kind of case studies and trying to demonstrate, okay, there are these small shifts that are happening. That's the only way. And I think, responding to your earlier question to Niranjan, I think I love two terms. There is one term I love is ecosystem, and the other is tipping point. So, you create an ecosystem for change, and that's one basic groundwork that any social development organization or even government system does. So, initially you may not see any change, but you are doing things that will take that community up to a point which is, we can say, a tipping point where change becomes visible. For instance, look at girls' education. If you look at it in the context of, say, that's the problem with projects which are of 3 or 4 years duration, where you are forced to demonstrate impact. It's so difficult to show impact in 4 years. I mean, something like, say, shifts in norms about working women. If you go back 20 or 30 years, the norms were very different. The norms are very different today. But even today, we say that female labor force participation rate is very low because there is so much unpaid care work burden on women to take care of. And therefore, constant talk of more creche facilities, more care support services, sharing of household work between the man and the woman of the house. So that's again a social norm. How do you measure that? These shifts happen over a longer period of time. They don't happen in 3-year project cycles. So that's, but if we are doing something like, say, an intervention to handle livelihood crisis created as a result of, say, COVID, then it's much easier. You will say, okay, so many loans dispersed, so many people's livelihoods have been rebuilt, so many acres of agricultural land has been brought under coverage to take care of, say, their protective irrigation. I'm just randomly rattling off things. Much more easier to measure, so those are concrete. Or if you say in terms of even COVID response, what we are doing, OXFAM is responding in close to 17 states for COVID. So many oxygen plants installed, so many beds or PPE kits distributed. It's easy to measure that. So I think it really depends on what is it that you're trying to change, and then what will you measure in that.
I hear you completely. So if we're trying to craft a roadmap, or if you're trying to bring about implementation improvements in, say, ICDS, it's a very, very slow burn.
Yeah.
So I think an important point is, 24 months or 36 months of a grant period will not suffice for an advocacy intervention. And just summing up what Niranjan said as well, I think that we need to, as MLE partners, I think we need to be more sensitive and possibly reflect on even the lexicon that we're using.
Yeah.
Probably KPIs linked to outcomes is not probably the right vocabulary that I should be using as an evaluator. Maybe I should just use a key milestone. Or I loved, Niranjan's example of, I've created a collaborative spirit between a policymaker and a researcher. That is huge success.
Yeah.
So I'm going to pause here, and I'm going to, because as I said, I could ask millions of questions, but I'm going to not be greedy and open up the floor for discussion.
Shreya has asked in the chat box, she said that integrating evidence dissemination as a practice so that evidence is used by different actors in the policy system, not just by the decision makers, but impact is too long-term to measure and processes are continuously changing. So what are your thoughts on this? 3 different perspectives from the implementer side, the policymaker side, as well as the evaluator side.
So just to break down that question, I think the first thing is, when we're presenting evidence, it's for different actors in the policy system, right? It's not just, say, the upper echelons of the government, but also, say, at the district level or at the block level. So I think what might be really useful is, how is evidence socialized within the system? If somebody comes up to you and presents impact indicators saying if there is spacing between births, neonatal outcomes are better. How is that piece of evidence, say, socialized within downstream within the system?
I agree with that, and this is really a very good question. And I tell you honestly, from one example of this kangaroo mother care that started. So it's not that that we have to take a call and there is a policy. You can make infrastructure, you create that. You can tell, you train your doctors and frontline workers and tell them, okay, any preterm birth or this, they require, these are the eligible people, they should do this kangaroo mother care. But ultimately, it has to be accepted by the population, right? It has to be accepted by the healthcare worker. It has to be accepted by the service provider. Again, Ranuji's ecosystem is there full on. And, it's like the dissemination, I agree. We don't have any institutionalized way. Like, I don't see it. To be honest, it's more like, there's something called like diffusion theory, right? I see that happening all the time. Things are happening and they are diffusing, and then slowly over the time, everything is happening. So I believe in that sense, somewhere it is not formally institutionalized, but informally, there are many ways by which this dissemination is happening. So maybe, it's a very good suggestion. Maybe, people like you all should come together and find out ways how we should be actually formally institutionalizing it. I mean, I just right now, nothing comes on top of my mind to suggest. But yes, informally, things are happening. I feel it, it's there. but to actually measure the objective, criteria, parameters, that system, I don't see it.
Kajal, I have a follow-up question, and bear with me if I'm not able to frame it articulately. Um, and this is taking off of Shreyoshri's point of the importance to socialize information at the block level, at the district level, etc. And I'm joining this with your earlier point of saying that data needs to be relevant. It needs to be of use to policymakers who feel the pulse of the people. Now, what if, for example, I was working in the space of delaying marriage, delaying pregnancy after marriage? And we've got this socio-cultural norm all across the country saying ki shadi ho gayi and you need to have children. Now, the question there is what happens then when, for two things. One is if you're when you work with people close to the community, there is also sort of that information which is coming back, sort of saying that this particular piece of evidence or advocating for this piece of evidence may not go anywhere because the socio-cultural norms are very, very strong. What would your advice be, therefore, to push for advocacy here? And it's not as if, for example, the government is not foraying into the pushing of social norms. They're doing it all the time for women empowerment. They're doing it for girls' education. So what would your advice to an advocacy agency be when you're dealing with something which is so socially charged?
That's really good, and I have really faced myself these kind of situations. And as Ranuji said, norms doesn't change overnight. They don't change overnight. It takes decades and decades to actually see the big change. So I agree. So this kind of situation I faced: early marriages, delaying pregnancies, and then family planning. Sometimes telling them to have spacing between two children. So something I would say, when advocacy you talk about, the framing of the narrative is very, very important. I see in these situations, I would advise that you really need to frame this thing in a way. For example, you must have read in theoretical books and all that vaccination, for example, there could be three persons out of 100 who will have the adverse reaction. But if you frame that 97 out of 100 will have better health, so these are the two messages. The percentage is going to be the same: 3% with the negative thought, 97% with the positive thought. So people will be happy to, we are humans. We want to hear what actually, it's good for us. We don't want to hear negative thing. So similarly, in these situations, for example, I'll give you one example. When I was working in the state of UP for health department, family planning is kind of a taboo. You just can't talk very freely. It's like something, even like menstrual hygiene, some topics are total taboo, right? It's very hard to talk to people and make them comfortable, come out of that and talk to us. So we started framing in a way that I don't want you to tell to delay your pregnancy or space between two kids or whatever. We used to tell them what are the benefits of delaying this, how many maternal deaths can be prevented, how many neonatal deaths can be prevented. So I framed it in a very, very different, narrative was changed. It's all about not, delaying or telling somebody not to have children, but the message was protect your wife, protect your kids, save them. It's in your hands. You can do it by this. So this whole thing was actually appreciated a lot in all the communities. We went to all the like Hindu, Muslim, different communities, and everybody, we told them, okay, even in your religious book it is written, if you can't provide a good life, you should not bring that life to this earth. So the message comes from their own books, their holy books, and everybody, every religion, every person wants good health for their wife, for their kids and all. You just need to bring that narrative. Don't tell them don't have kids. Don't tell them you need to have only 2 kids or 1 kids or whatever. Let them make their choice by telling them, okay, this is good for your wife, this is good for your children. So I think in those charged up atmosphere, you really need to change this narrative, make it more positive, Tell them what resonates again. You tell them this is written in your holy book. Only, bring that life to earth when you can provide something good to them. It's there, it's there in the books. So you quote those things and they'll understand, they'll listen to you. So that is how I worked. So it really took off, and this program actually worked very well. And we have seen the results. I mean, UP has come a long way, I would say. In under TFR, we had approximately 3.6 when I was there, I guess, in 2012. It's now around 3 or 2.9. I don't remember the exact figures, but again, it's not just one thing. I'm not taking like the whole credit. There is a lot that is happening. Education system is going better. People are getting aware, a lot of information coming up, but definitely, we could speak about it. That thing was broken, that barrier was broken. People allowed us to talk, and they came and listened to us, and they actually told us that we are going to now work in this direction. So that is something I can say that can really help you when you really face these kind of challenges in the system.
Niranjan, I have one question for you, and this is sort of kind of a data question, which is of course an obsession of all evaluators. Actually, two questions. The first is when you are sort of using data for advocacy, what are your sort of thoughts on say what has your experience been when you're drawing on, say, a national database like an ACER or an NFHS versus, say, a private sector database, which might just be like 1 lakh people or 50,000 people? So that's question one. So I'm saying, what is viewed as credible data for us when we're sort of quoting data? And the second thing is that, do you find it useful to locate data or provide data at the ward level, like say HMIS, to think that data is more, lends itself to uptake more because, at the ward constituency level, or where do you then take the decision to say provide district level data? So, as an evaluator, or people who deal with data all the time, where should we be pitching the data, or is it different for different things?
I think, it's different for different things. And if I answer your first question on the national database versus the other special surveys that usually the organizations conduct, the more than whether it is a small data or some other survey other than the National Family Health Survey, more than that, the credibility and the design of that survey actually becomes critical. And that's where I think the policymakers and our experience has been that the National Family Health Survey data is taken seriously into consideration, but all the time the policymakers would look at that as the performance of the program and to determine how is the program moving over time. Whereas these other surveys actually is doing more in-depth analysis of the data to actually inform or gives some sort of the solutions or suggested recommendations from the data to the policymakers, and that's what they find it useful. Now, whether that can that not be drawn from NFHS data? It can definitely be drawn from NFHS data. And but the frequency of that NFHS data is also it has the time lag of 3 years to 5 years, and that's where different data is used for different purposes. And when we talk about the usefulness, for example, it all depends who wants data and at what level they want the data. The state level policymakers or the program managers would like to have the state level results, whereas the district level people wants to know whether it is the member of legislative assemblies, MLAs, or the panchayat leaders, or the district medical officers want to know what's happening in their districts and block level. And do we have credible data at that level? Is something that we need to keep thinking, meaning that what credible data do we have at block level? Is the HMIS data is credible enough? Yes, it is. It actually provides a lot of information to provide the trend. Can that be used for decision making? One has to look at that very carefully. In terms of, because whether it determines the whole status at that block level or at the district level, is it representative enough to capture both public and the private sector? So there are a lot of and this actually, from my point of view, this discussion, you need a separate webinar.
I completely agree. In fact, I was thinking of some ideas for the next sort of the next chat on data. So I'm glad you sort of corroborated, Niranjan, that we do need more time on that. Just wrapping up, I hope you enjoyed this as much as I think Xenia, myself, and Shreyashi enjoyed putting this together. And firstly, a huge thank you to Kajal, Ranu, and Niranjan. Always a pleasure. And I think each of your points in the PPT or each of your slides in the PPT is actually a webinar. And I will be reaching out to all your brains soon. And I think we have a lot of food for thought as evaluators. We have a lot of food for thought in terms of toolbox of advocacy strategies. This has been absolutely fantastic. And thank you to everybody else who took the time out to participate. And a big thank you to Xenia and Shreya for just organizing this entire webinar, and kudos for doing a fantastic job. So thank you, everyone, and we hope to see you soon. And keep the deliberations going. And have a good rest of the week.
Thank you. Same to you.
Thank you, everyone.
Thank you, everyone.
Thanks. Bye.